today's episode, I want you to join me as I take you through the challenge of showing you if your cough is just a tickle in your throat or is something more serious to pay attention to. Now, over 10% of the world population actually suffer from a cough one time or the other. And that is almost about 900 million people, almost a billion people suffering from cough. And sometimes people push this under the carpet and only to realize that this is very, very serious. So I am going to walk you through some of the type of coughs and some of the reason for this kind of cough and when you should see a physician to evaluate you. A cough can, range from what we call a dry cough to a wet cough. Okay. Now, dry coughs, most possible causes of dry cough include viral etiology. People have a simple cold and they have a cough, it can be dry, or COVID, or people have allergies. Allergies can also produce dry cough in people. Asthma can produce dry cough. People with acid reflux disease can experience dry cough, or just postnasal drip when you have a cold and you have drainage at the back of your throat. Those can cause, a lot of nuisance cough at night. And people who may have cough at night when they sleep, and those can be either postnasal or it could be just be allergies or acid reflux, because as you lay down, your acid surge and can produce a lot of dry cough. And you've seen patients who have suffered this kind of cough and they've gone to the physicians and they've given them just cough mixtures and it's not helping. So you need to pay attention when you experience this type of cough. Then we'll be able to make the right diagnosis and help you. The second type of cough is a wet cough, where people produce phlegms, or we call mucus, right? And this is very funny because people come to see me and they say, well, I have a green, yellowish mucus, so I'm infected, so give me antibiotics. I mean, they're very serious, right? But again, just to educate you a little bit here, the brown or green or yellowish mucus does not necessarily means that you have a bacterial infection. It's just the sloughing of the epithelial cells when you cough things out, and so the color changes. All right, so people can have that kind of thing, and most of the possible causes of wet cough can be acute bronchitis, pneumonia, people with chronic obstructive airway disease, even postnasal drip sometimes can have a wet cough. And most of the time, people bring up, what we call sputum. Then people also have persistent cough that lasts more than 3 weeks. Now, again, the rule of thumb, this is what I tell people: if you've been coughing for more than 3 weeks and you try all the over-the-counter stuff and it's not working, you should report to see a doctor. Do not stay at home if your cough has lasted more than 3 weeks and you're not getting remedy to it. You need to be seen immediately because it may be more serious than you think. And most of this chronic cough could be seen in asthma, chronic bronchitis. Again, people with acid reflux, smokers cough. If you're a smoker, you can have all this cough all the time. Or even people can have more serious things like lung cancer. Okay, so that is why it's very, very important that if you're coughing for more than 3 weeks, you should be seen and be checked immediately. Now, there are certain things that accompany coughs that you should be seen immediately. Do not wait. The first thing is that if you're coughing up blood, that can mean a whole lot of things, okay? It can mean a whole lot of things from clots in your lungs, tuberculosis, pneumonia, lung cancer. So it's a whole lot of so if you're coughing, is blood in your cough, you gotta go see a doctor immediately. If you have shortness of breath, you're wheezing, you just can take a deep breath, you have that oxygen measuring, pulse oximeter at home, and your oxygen level is less than 95%, you should go and be seen and checked out immediately. If you're having a fever of over 101 degrees Fahrenheit, that's about 38 degrees, 0.3 centigrade, and it's lasted for more than 3 days, you should go in and be seen immediately because that could be a sign that you have something that is more serious. If you are confused, you're an elderly person coughing, you're confused, your lips your lips turning purplish and blue, you fatigue, you gotta go in. Or if you're having a dry cough that you can't lay down flat on your bed, waking up in the middle of the night, your legs are swollen, your ankles are swollen, those will be a sign that you have a cardiac cough. And again, you should go in and be evaluated. So instead of just trying over the counter stuff for cough, which most people do, which is okay, although most of those things do not really help. If it's just a simple virus, those will take their course. But the rule of thumb for this video is that if you've had any of those things that I just listed above and your cough has lasted more than 3 weeks, you should go and get checked because it could be more serious. So not all coughs are just viral or infection, as I listed above. So make sure that your physician has made the right diagnosis for you so that it can help you. Because if you have acid reflux and we treat that, your cough will stop. Or if you have allergies and we treat your allergies, your cough will stop. So these are the things that you should pay attention to if you're experiencing a cough. So I hope this video has been helpful to you. Subscribe to the channel. Leave us a comment if you follow some of this information I've given you and you have relief from your cough. Come back and share your experience with us so that our viewers can also learn from it. Now remember, in the 21st century, you are your own physician, so you got to pay attention to your body. Until then, I'll bring you another episode. Dr. Moses.